And we have Dr. Lauren Mack with us. She is the owner of the Animal Hospital in Plainville. Is it somewhere else too, or is it just Plainville?
And Phillipsburg.
And
Yep.
Phillipsburg. Okay.
Mhm.
Awesome. Well, I'm going to have her take it from here. And whenever you're ready, Lauren.
Thank you. So I own both clinics in Plainville and Phillipsburg, and I'm a 2014 graduate from Washington State University. So I'm not a Kansas native. If anyone wants to know how I got here, we can talk about it later. But I'm a DVM, so I'm a doctor of veterinary medicine, and I'm essentially licensed to work on every species except humans. Okay. And what I kind of want to talk to you guys today about is I want to go through the opportunities in veterinary medicine. There's a broad width of what we do as veterinarians. Kind of talk to you about how you can get a veterinary degree and then what to expect on kind of the logistics of that. So we'll kind of start with that first, the different job options. And the most common job that veterinarians take at graduation or that do every day is what we'd call general practice, which is what I do. I do a mixed general practice, meaning we see everything from cats and dogs and cows to guinea pigs to horses and sheep and goats and pigs. And, my general rule is I won't see anything venomous and I don't like monkeys. That's kind of the only rules I have. And so we have a diverse patient load, and I work every day seeing patients, taking emergency calls, kind of handling a rural mixed practice setting. Okay. The majority of veterinarians, though, are not mixed. Okay. The majority of them do what we call small animal only, and that would be cats and dogs exclusively. They tend to work, majority of veterinarians work in urban to suburban areas, 8 to 5, see cats and dogs on scheduled appointments. And if they do have an emergency patient, they ship them to essentially an emergency center or an emergency hospital. And there are veterinarians who work there seeing emergency patients essentially only. Okay, so that's a typical dynamic in that setting. Okay, there are people that see exotic pets. And some people do it exclusively. So we're talking about everything from parrots and snakes to guinea pigs and chinchillas and sugar gliders and all the what we call pocket pets or other than cat and dog pets. Okay, so some good examples. I have several rabbits as patients. We have several guinea pigs. We have an albino boa named Dumbledore, who's fantastic. He's a lovely snake. We also have a couple of chinchillas in the practice that we work on, a couple of birds, and that also includes everybody's chicken flock. They're also kind of in that weird little category of animals that we work on. And then there are several veterinarians and lots of vets out there that work on large animals only. So there are some people that do cattle work only, either dairy practice or beef practice or both. And there's a whole subsection of veterinarians that see only horses. Okay. And this is really dependent on where you work, where you live, what the population of animals is like, and what you want to do, what your passion is within the profession. Okay. And then always the ever coveted, there are always people that want to work in zoos. And there are positions, though they're rare and small and hard to find, where you can be an exclusive zoo veterinarian and work for like San Diego. Okay. So those are kind of the cool general practice structures. As we move from there, you can also specialize. So kind of like in humans where you'd have a cardiologist or an oncologist for cancer or strictly surgeons or strictly criticalists who only see critical patients, you can specialize past your general degree, past your DVM. Okay. And that usually includes an internship, which would be a year where you're a licensed veterinarian, you're a licensed DVM, but you're working under a subsection of clinicians doing a full internship, learning your specialty or your category of specialty. And then typically that moves on to a residency, where you do another 3 to 5 years of specific study in your specialty. Very similar to the human medicine structure there. And then you take boards and specific examinations for your specialty. Okay. So you're looking at a long stretch there. And we can talk more about the years, the time, and the money as we go. Okay. And is it my understanding that if someone has questions, someone will interrupt me, or are we saving them for the end?
Yes, we'll interrupt. We've got about 5 minutes, and when we'll come on and tell you it's time, you'll see me, Jackie, come on, and yes, that's what we'll do.
Great. So those are sort of your active practicing degrees. And that is what the majority of our profession does, is practice on animals, on patients on a regular basis. But for some people, they either become bored by that or were never interested in clinical practice and like other elements of our profession, and they are extremely important. Okay, so another category of this is research. And there's a whole group of laboratory professionals and research professionals with veterinary degrees. Okay, and some of them go through that specialist process, but they do a residency and get boarded in pathology. And pathology is where you take all those tissue samples and all those samples from patients and do autopsies and necropsies and can kind of go further. Now, I do necropsies, but they'll take samples of that, look at them on a cellular level, tell you what you're dealing with, if it's a tumor or a disease process. And they do that work. And some of them are in research, some of them are in active laboratory study. So some great examples of my classmates from vet school. So one of my classmates' name was Liam. He would love me to tell you this story. He is not a people person. Clinical practice was not a good fit for him. And he knew it. This is not a lie. He did not like practice. He never really went that way. He got a 5-year pathology residency in pathology, got boarded in pathology, and is doing some really exclusive research on kidney disease in cats linked to color genes. And is finding out that some of the kidney disease problems we see that basically take the lives of many of our feline pets every year is linked to some of the color genetics that we're looking at. And he's big in that research. It's fantastic. I also have a classmate who is working on a team that developed one of the COVID vaccines. She has a master's in biomedicine, DVM degree, and is working on that research team. So don't believe you're limited to clinical practice only. There are other professionals that work in what we would call industry, and they typically work under the big companies, and they help educate other veterinarians, educate producers on products and diseases and opportunities. Some of them work for like poison control centers, like ASPCA has a great poison control center that anyone can call, including me, and discuss that. Those are toxicologists who have specialties. And then some of them, some of the big cow vets sit on, like, for example, the McDonald's board and talk about our food chain and our food supply and how we raise animals properly and what needs to be done, and how we don't see McDonald's saying antibiotic free. And we don't see certain things like that. There are people influencing that from our profession. Every time you see USDA stamped meat, there's a veterinarian involved in making sure that that meat process was safe. And so there are definitely vets that work on the government side, that work for the USDA, they work for APHIS, they work in disease control, importation, exportation of products and animals at our ports and our airports, and use their knowledge of disease management to do that, okay? And then there's also the very prestigious Vet Corps, the Army Vet Corps. There are several military-based options for veterinarians as well. So you can join military prior to vet school and they will help pay for your veterinary degree, or you can join after at a substantial rank and travel internationally, help set up biosecurity structures, work in lab structures, do research, etc. Okay. So there's this wide breadth of opportunities in the vet degree. You don't just have to do rabies vaccinations for cats and dogs. Okay. And most of us do a lot more than that in the disease management and control side. So that's kind of the width of what we talk about. And most people see, just the general practitioners, but I want you to understand that there is a huge array of opportunity. Okay. And there's a couple keys about this. Our profession is really about people, not animals. That is a common misconception. I've even had MDs look at me and be like, "Oh, so easy. Your patients don't talk to you." And I'm like, "How is that easy?" And I'm like, "Trust me, their owners do." So we work with people just as much as we work with animals. And so if you don't like people, the veterinary degree is not for you. Okay. Even Liam, the pathologist, has to work with other veterinarians. Okay. We are also stewards of medicine and antibiotic usage, and we try to protect our food supply as well. So if you have an interest in that segment, the veterinary degree can be a great place to start with that as well. Okay. So how do you get there? That's a common question. People tell me all the time. I go to airports, I go anywhere, and they're like, oh, I wanted to be a veterinarian. And I'm like, that's great. I support that, but there are a couple things you're going to have to accomplish. And I heard Dr. Heller talking about science-based classes, go for that 4.0. Our profession is just as competitive, if not more. So you really are looking at get really good grades in high school, go to a college program. You're going to have to get above a 3.5 in your college program to be competitive. Okay. Typically science-based programs. So I have a bachelor's of science, of animal science, with a minor in veterinary science. And I got close to my microbiome one. So those sort of hardcore chemistry, biologies, really important for us. Okay. And then also experience. I never encourage someone to pursue the sort of rigorous, lengthy course of getting your veterinary degree without doing getting an extensive amount of experience with multiple veterinarians in multiple settings. You know, our job is not all puppies and kittens. I wish. We do appreciate those though. We have lots of death and lots of challenges and lots of elements of our profession that are something you want to be exposed to before you take that pathway. Okay. And then veterinary school is a 4-year program as well. It's a 4-year graduate degree. You go through 2 to 3 years of classroom work, essentially, with some clinical teaching and some hands-on laboratory work, and then do at least 1 full year of rotation clinical experience where you're seeing patients, you're working with clinicians, you're working with those interns and residents, and learning the actual practice portion. Okay. After that 4 years, you can graduate and go practice. That's what I did. You can go practice from there. You don't have to do that internship and residency. Okay, that's more of your specialist portion. Okay, and then pay-wise, don't come into this one for the money. We are not well paid for doctors. It varies based on region. So in rural regions, our salaries tend to be lower, 70 to 85, somewhere in there, 70,000 to 85,000 a year. But your cost of living is substantially lower. You head for a more urban area, you might start in the $90,000 to $100,000 a year. Our debt load is also substantial. I think the average graduating veterinarian was sitting between $170,000 and $200,000 in debt. Okay, so those are things to consider and plan. And really, if this profession interests you, start planning now. Start getting exposed to someone who can help you get there, and kind of working your way through that process. Okay, so that's kind of what I had for you guys as a summary. Questions, commentary, whatever else I can do for you.
One question that was brought up, besides having daily appointments, does your schedule change often, and how do you plan accordingly for your day?
My schedule changes every hour of every day, and no 2 days are the same, especially in a mixed practice, because if a calving comes in, my whole day just went to heck. If I have patients cancel, I had a cat that was supposed to be spayed today who turned out to be a boy. We're like, oh, okay, well, that will be a different procedure. You have emergency visits. So I don't think if I have a day that went as planned, I actually joke, I'm like, the phone's going to ring all night because it just went too smoothly today. Flexibility is key for us. Mm-hmm. We rarely follow a pattern.
Yeah. You talked about, get the right experience. What would you recommend for a high school student to start getting that experience?
So I started, and many of us started, with cleaning kennels and mucking stalls. I have mucked more stalls in my life than I care to talk about. And I have hand scrubbed many a dog kennels and walked dogs. It's valuable to start from the bottom up. And as a business owner, now that I'm in charge of everything, it's important to have done everybody's job. So go assist during the summer, go be a kennel worker, show interest in the profession now. And if you work hard, work ethic is a huge thing. Don't complain about cleaning kennels, and sort of kind of walking into that category with a good mindset, someone will help you get that experience. So my high school students that come in and work their butts off, Sometimes I'm like, you want to get in the truck and come see this cow with me? And they're like, yeah. I'm like, get in the truck now. Like,
Let's
you
go.
got 5 seconds. Let's go. And get that experience and get under somebody's mentorship will
Yeah.
be a huge deal for you.
Yeah. And I know our theme always is, get the work study opportunities, take advantage of internships, even during high school, and through
Yes.
Next Gen, students can do that from age 16 on up. So if you're interested, any students, and soon we'll be, posting even positions, and you don't see a business or a vet clinic or somebody out there that you might want, contact me, because we can try to make that happen.
Just reach out.
That's right, reaching out. You talked about vet, but what about the vet? If they want to become a vet tech,
Yes.
what level is that, and are there opportunities for that?
So there are 2-year opportunity programs. So they're not bachelor degrees. We don't really have a bachelor system for that. And so you have the opportunity to go to a 2-year technical program and then look at licensure for that. And that will bump you up in pay in the field. Still need to get experience, still need to do all of those things. And that is essentially like an RN nursing degree in the essence of what you do. So patient care, surgical monitoring, etc. I also have a number of people that work for me that are not licensed that we train, and you can be very successful in that category as well. So you don't have to go for a schooling degree, or you can. I also have employees with animal science degrees that were helpful to them, 4-year animal science degrees as well. So like my lead cattle tech, the lone male in our clinic, has a 4-year bachelor's in animal science.
I noticed behind you is a chute. So if you can, as a vet, you also have to deal with equipment.
I have all the pluses and minuses of business ownership. I have a team, I have HR, I have payroll, I have insurance, I have professional licensure, which I heard Dr. Heller talking about. Mine's cheaper. I laughed at him. It's like, that might be something we laugh about. I have equipment, I have buildings. My husband and I joke about how many toilets we own between our home and our Airbnb and all of my practice stuff. I'm like, all of those pieces fall into place. And just like Dr. Hellard talked about, we aren't trained well in that. If you have an interest in business ownership, find yourself a mentor that can help you. Because we had a little bit more. We have what's called a Veterinary Business Management Association that I speak to a lot. And it's a separate club at each of the vet schools to try to do some training in business, but it just scratches that surface of what I actually do every day. We manage vehicles. We're a weird mix of service business and medicine, because we don't have insurance companies to back us. So vet med is paid out of your client's pocket. It's complicated some days.
Right. Yeah. You mentioned at the very beginning, kind of finding what's your passion.
Yes. Your passion in this profession cannot just be animals. Okay. And don't get me wrong, I love my patients and I love working with my patients, but you have to have a love for medicine, and solving problems and digging further. And you have to have a love for people and helping people and support your community and your producers, in my case, your clients. And then within the profession, people find things they're passionate about. We talk about small animal only. There are some people that work on cats only. That would not be my first pick. I love cats, but I don't think I want to do it all day. Many of them think I'm insane for working on cattle. So there are even, like, it takes all kinds type message to even work within the vet profession.
And when you're looking at a rural vet, typically rural area vets like we have, like you are, like we have in our area, you're going to get a full gamut.
Yeah. To eat, I mean, let's be honest, to run a business in these smaller communities, you have to be kind of willing to see everything. And that's also what attracts people. My newest associate told me, I said, what attracted you to this practice? Because the vets are hard to find right now. It is a hungry business.
There you go. Listen up.
Yeah, we are running so short, it's not funny. Like, it's one new grad per 22 jobs available in the United States, if not worse. So I asked her, I said, so what drew you specifically to this practice? And she goes, you told me you saw 8 species in one day. I want to do that.
Very
Great.
cool.
So yeah, so that's also a different element to a mixed rural practice.
Sure, that's great. Well, Dr. Mack, thank you again for joining us. It's always great to have you be part of our Career Day events.